नॉर्मल प्रोस्टेट साइज का अधिक बढ़ना, जो कि एक उम्र के बाद बढ़ता है हार्मोन लेवल की वजह से, वो कोई कैंसर रिलेटेड नहीं है, वो नॉर्मल मास है, बस बढ़ गया है जिसकी वजह से हमें कष्ट हो रहा है। मेजॉरिटी ऑफ पेशेंट्स आर फ्रॉम ओल्ड एज ग्रुप, बट BPH may happen to early or young adults also, comprising from age anything like 30 and 40 and 50 decade. BPH symptoms are weak stream, increased frequency of urination, nocturia, that means we are getting up at night multiple times to pass urine, and unable to control urine, that if we can't even reach washroom and there is some urine leak may occur. Other symptoms are blood in urine, or patient is feeling that he is not able to pass, and if symptoms worsens, total shutdown of urine or unable to pass urine is the major complications of worsening symptoms. Don't hesitate, don't bother with these symptoms, just contact your urologist or physician and you will get better.
Hello and welcome to Urology Unplugged, your trusted source for breaking down urological health topics in a way that easy to understand and actionable. I'm your host Vivek Kumar, and today we are focusing on benign prostatic hyperplasia, a condition that affects millions of men but is often too misunderstood. We are joined today by distinguished expert Dr. Shubham Lavania, a consultant urologist. Thank you, Dr. Shubham Lavania, being here with us.
Thank you.
So, sir, let's start our today's topic, BPH, benign prostatic hyperplasia.
Yes, sure.
So, sir, let's clear the view of our family members or our audience, urology family members. What is actually BPH?
BPH, as you have already told, benign prostate hyperplasia. It means that it is a condition in which normal tissue of the body is overgrown in the ratio that it is causing some obstruction in urine. सिंपल भाषा में कहें कि नॉर्मल प्रोस्टेट साइज का अधिक बढ़ना, जो कि एक उम्र के बाद बढ़ता है हार्मोन लेवल की वजह से, वो कोई कैंसर रिलेटेड नहीं है, वो नॉर्मल मास है, बस बढ़ गया है जिसकी वजह से हमें कष्ट हो रहा है.
Alright, thank you so much, sir, for clearing a view of what is BPH. So, sir, my question is, when should someone consider to a doctor regarding BPH?
BPH causes some symptoms and some trouble to the patients. These are like increased frequency. Person will suffering from BPH has to go quickly and with increased number of time compared to other person. He may get up in night 4 or 5 times for urination. He may feel that his stream is not good. He has to make some effort to pass urine. He is unable to control urine. He can't hold urine for long duration. These are few symptoms which make patient's life troublesome, and for this, if they are having such symptoms, they should visit to urologist.
Wow, sir. So there's a few symptoms if anyone face, so they can consider a doctor. So, sir, there's a lots of myth and fact about BPH. So, sir, my first myth or fact, इसको आप elaborate करेंगे properly. So, sir, my first question is, BPH is only happen to older men?
It is a myth that BPH only happens to older men. Yes, majority of patients are from old age group, but BPH may happen to early or young adults also, comprising from age anything like 30 and 40 and 50 decade, and this usually happen if patient is obese, if a patient has a family history or normal morbidity changes, as well as some lifestyle like early anxiety, excessive intake of coffee or can irritate your bladder and may lead to BPH in early age group.
So that's great, sir. So, sir, the next method or fact you clear again. So, sir, the surgery is the only option to BPH?
No, BPH can be cured in multiple ways. First thing first, we should go for lifestyle change, simple habit to avoid liquid intake like tea, coffee, juice at night time. In Indian scenario, you have seen many people used to take milk at night time. If we omit taking excessive liquid night time, or we take it or shift it to morning, we can stop frequencies and symptoms of BPH for long duration. Another lifestyle modification is just sleeping at night, timely physical exercise, because muscles has to do the work. These lifestyle changes, avoiding tobacco, liquor, also help. So these lifestyle changes, diet modification helps lot. So coming to next step is the medical management, or what we say tablet therapy. So in medical management there are wonderful medicines which usually we prescribe, and initially we used to prescribe these medicines only along with lifestyle modification, like alpha blocker, one group of medicine very common, tamsulosin or silodosin. It is very worldwidely given and very safe. People used to take this medicine just once a day for many years if patient is easily controlled on these medicine. Then comes minimal invasive surgery or procedures. We don't, I should not say it's surgery, it is just a procedure which can be done in a day or two. And in that category comes like clipping, or just using laser. We can do the procedure and we can make prostate accessible. We can cure the patient with very limited hospital stay. So prior to surgery we have lot of things, we can help patient with many things.
Right, sir. So before any doctor to consider, we can change our lifestyle. It's also a better option for us, right?
Yeah, it should be a first step towards anything.
All right. So, sir, the another myth is drinking more water can flush the BPH symptoms.
No. It is very well asked. It is a myth. Basically, in any case of urology, any problem of uro, people used to think drinking water will flush out the disease. But in fact, in BPH, excessive intake of water will lead to excessive symptoms. So, a moderate amount of water which is required, as early I have told you, taking less liquid at night so we can sleep well, and taking adequate fluid, not too much, in daytime will also relieve some symptoms. So lot of taking water in BPH is harmful. In fact, in winters BPH symptoms worsen. In summers BPH symptoms comparatively good, less worsen.
All right, sir. So let's talk about the symptoms and impact of BPH in day-to-day life.
Yes, BPH symptoms are weak stream, increased frequency of urination, nocturia, that means we are getting up at night multiple times to pass urine, and unable to control urine, that we are, if we can't even reach the washroom and there is some urine leak may occur. Other symptoms are blood in urine, or patient is feeling that he is not able to pass, and if symptoms worsens, total shutdown of urine or unable to pass urine is the major complications of worsening symptoms. So these are the symptoms, and this all symptoms makes very life tough for the patient. If patient has not able to take sleep, he won't be able to work at daytime. If he can't is a normal journey by some traveling, if he is in bus or if in any car, he has to stop the car or bus for multiple time passing urine. He is unable to sleep, unable to do work. He is going in office hours a lot of time urine, and coming blood to the gives mental trauma to the patient. So it makes lot of quality of life poorer if symptoms are severe.
It's totally affect our human life, right?
Definitely.
Okay, sir. So let's talk about we talk about the symptoms and impacts. So what are the solution of BPH, and how do you decide the best way of approach to the patient?
For the patient, if he is having some bothersome symptoms, don't think that it is part of age or don't think कि my body is like to be this only. Please consult to urologist. Get it quickly relieved by lifestyle modification, medication, and if required, minimal invasive surgery. For my point of view, patient when comes to my consultation, we used to assess patients' symptoms and with along with symptoms whether he is having any complications or he is having any other difficulties along with. If it suits patient, we starts with lifestyle modification and medication. If medication fails or there is some complication along with BPH, then we go for minimal invasive surgery.
All right, great. So, sir, these are the symptoms and the impact and treatment you already said us. But, sir, let's talk about the real story. Like, do you have any patient who have such kind of the symptoms and the problem, and anyone have early diagnosis?
Yeah. It is very common in Indian scenario that and especially thanks to our health system, when our age is also increasing compared to previously. So we have lot of old people nowadays compared to earlier days because of good health system. Good. So number of patients are also increasing, and previously because there was less awareness, less rural patient especially thinks that these are all age related process. With age I will have gray hairs, I will have weak stream of urine, I will be walking very slowly. So people think like this, but when they start taking medicine or they go under intervention, they really bless us with all the blessings that we have made their life very easy. And yes, in it is I have one patient of age of 45, and he got operated because of BPH. Because sometimes size of prostate is not important, but the overgrowth of prostate into the bladder, towards the bladder, cause obstruction, and in such cases even medication is not good. Then we go for surgery, and I did surgery and he is relieved with it, and he is in now good health.
All right, that's great, sir. You have already such kind of patients and you care properly. So, sir, let's give us some actionable advice to our listener. And how can men proactive their health up regarding BPH?
Yeah. So my piece of advice for the listeners is be active, and increasing physical activity also improves your health, not only for BPH but for many other things. Taking less amount of liquid at night time also help you to take a sound sleep. Stay away from anxiety. Mental health is also important for your physical well-being. So less of anxiety, more of meditation, and more of another thing is, if you feel any symptoms which we already discussed, like increased frequency, nighttime awakening, weak stream, or any family member having such trouble, kindly consult to your urologist or nearby doctor for your help. Thank you.
All right, sir. Thank you so much for a better and proactive health tips to our listener. But sir, we have some questions from our listeners. So can I ask you?
Sure.
Sir, the first question is to you. Does stress makes BPH symptoms worse?
Yes, stress and anxiety can cause you or can increase your symptoms. Like if person is having a increased frequency and he is having a stress, then he might be thinking more about his disease, and he will be going again and again for pass urine, and all this will cause disturbance in its physical as well as mental health, and it will further increase his stress.
All right. So, sir, what's the final message to the person who are dealing with such kind of symptoms, BPH, and what's your prostate health regarding to them?
Yeah, healthy diet,
Okay.
good exercise,
Okay.
yoga and meditation,
Wow.
they do help. Even after that, if you are having any symptoms, don't hesitate don't bother with these symptoms, just contact your urologist or physician and you will get better.
Alright, so thank you so much, Dr. Subham Lavania, for sharing such of insights and valuable thoughts and actionable for our listeners. So thank you so much, family members, to our listeners. सो आई होप आप सभी को काफ़ी कुछ बहुत ही प्रॉपरली वे में आपको समझ आया होगा एक्चुअली BPH क्या है, BPH के सिम्टम्स, हाउ द इम्पैक्ट इन आवर लाइफ, व्हाट आर द सॉल्यूशन, व्हाट आर द सम एक्शनेबल प्रोएक्टिव हेल्थ टिप्स गिविंग बाय डॉक्टर शुभम लवानिया. सो थैंक यू फॉर joining us, and please share it and subscribe it, and also share with others people, those who are facing such kind of problems. It's really help for them. Stay tuned, stay connected with us. Urology Unplugged, always for you with some of major and better health topics for you.